colleagues. So learning to telling them how they're special children to have that condition, and then why you need to do this.
Okay, so so you advocate that parents should know, and that the children
should be told.
They should be talking to their children to
yes.
tell them to learn about their condition.
Yes. The mothers should know, and that also comes from the health workers. You heard from Kathy's story.
She went to different
at different health centers, and they were just actually avoiding her. Maybe they didn't have the knowledge about the condition, or they knew, but sometimes they failed to break the bad news about what it's all about, the spina bifida. Some people actually just avoid it and keep referring the problem to another person.
So maybe let's talk about the signs. Maybe the problem might have been they didn't know she actually had the spina bifida.
Yes.
They just see something is wrong. Someone is passing urine, but they can't really tell. So what are some of the signs to show that, okay, there might be spina bifida? Let's do this examination, not do this test.
Yeah. So it's actually important to examine all newborn babies. Look at the back. Usually the commonest is there is a swelling on the back. It depends on the different levels, but there might be a swelling on the back. But like I said, spina bifida also has different types. It can range from the smallest being just a dimple on the back. Do not take it lightly.
As if it just like a small depression.
Yes, a small depression or a dimple on the back, or a growth of hair.
Okay.
Or the overt swelling, which is very visible.
Okay.
Yes.
So those are the different forms of this spina bifida.
Yes.
Wow.
Sometimes that swelling can be open with some water coming out of it, or sometimes even bleeding from that swelling.
Okay.
And then also sometimes the dimple might not be very visible and obvious, or people can take it lightly, but there might be associated weakness in the limbs. So if a child has some deformity in the limbs, you also have to check at the back and see if there is spina bifida associated with that deformity in the limbs.
Yes, so we are in studio again talking about spina bifida, and we are glad to host Miss Kathy, who is an advocate for spina bifida. She's teaching us all about her experience with the condition and helping support fellow, I think, children and youths who could be having the same problem. And Dr. Agatha, who works in the Cure Hospital in Mbale that treats spina bifida. So we'll be right back after the break to talk more about the impact of spina bifida in society. How does it affect someone as an individual? How does it affect a family? And most importantly, is there any way we can treat and prevent it? Because it seems to have lots of complications around it, and wouldn't want other people to go through the same experience. So we'll be right back. Please follow us on our social media platforms, on Facebook, on Twitter. You can also subscribe on our YouTube channel, that is the Doc Talk Show, and we'll be so happy to hear from you. In case you have any questions, just raise it on our platforms. We'll be happy to respond. Don't go away, we'll be right back.
You are watching the Doc Talk Show.
Share her experience with us, with Uganda, so that we can help fellow Ugandans who may be suffering from the same condition. So, Kathy, I imagine it has been a very difficult time growing up, and I'm just curious, aside the psychological, because you mentioned the stigma and the discrimination that came with it, but health-wise, has this condition affected you physically? Have you had any other medical problems that have come because of spina bifida?
Thank you so much, Doctor. Yeah, health-wise, it has affected me very much, in that I was born when both of my legs were there, and now I acquired the wounds that were on the heel and on the ankle. We tried to dress them. They did some surgeries, but they failed to heal. So they ended up becoming septic, and also they acquired gangrene. That gangrene that cannot even heal. So we just ended up, the doctors ended up amputating my leg, that is cutting off the leg, my left leg, and now I had to use 2 crutches and my prosthesis, that facial leg. Sometimes I use it, sometimes I don't use it. So when I use also that facial leg, since we have a low sensation, I get wounds on the stump.
Okay.
Because
So-
you don't feel pain actually.
They don't feel pain.
They don't, yeah.
So I get wounds, and at my workplace, everyone, but Kathy, why are you not putting on a leg? It is very hard to explain to them, however much you explain to them, but I get wounds. But others, I see other people using it. How come that you work in a disability center and you are not putting on a leg? You know, they so much judge, however much you explain, they cannot understand. So just because for me, I know that my sensation is low, I get wounds, I can put on that artificial leg sometime, then I remove it.
Then you remove it,
But
okay.
I so much use crutches.
Okay, so you've had this surgery called amputation, where one of the legs was removed because of a wound that was on the leg. So maybe Dr. Agatha, you could explain to the audience more. Why was her leg cut?
Cut. Okay. In the management of the spina bifida, we do surgery, but we don't stop there. After surgery,
on the back.
yes, surgery where you cut off that swelling and cover the exposed spinal cord. But you don't just stop up that surgery. There's a lot more because these children have the reduced sensation or limb deformities. Because of the reduced sensation, they don't feel pain sometimes downwards in their limbs, so they are prone to every injuries. Even fire can burn them when they are not.
And don't feel it.
They won't feel it.
Wow, okay.
Yes. So, and also because of the reduced sensation in their limbs, they have difficulty with walking. So they prefer, most of the time they keep in a sitting position. And you know that when you're in one position for long, you tend to have wounds, what we call pressure sores. Pressure wounds, yes.
Are these the ones she was talking about on the legs?
Yes, those were on the feet, yes, but then others can happen on the buttocks.
Okay.
Because of constantly being in a
much
sitting
sitting.
position. And even then, when they try to crawl, they can want to shuffle on their buttocks. So they keep rubbing on rough surfaces without feeling that pain. So they end up with those wounds. So one of the post-surgical management that we do is physiotherapy. We teach the mothers how to constantly change the positions of these children, not to leave them in one position that can predispose them to the wounds, but also physiotherapy to be able to, for this child to walk, to ambulate. Yes. Then also, the other one is because they are incontinent of urine and stool, we teach them to remove urine and stool, because you know that urine, when you're constantly in wet clothes, they tend to also burn them. They get a lot of burns from the being constantly wet with the urine.
Okay.
So we teach them to remove urine so that they stay dry. Yeah. So constant burns from the wound can also predispose them to the wounds.
Oh.
So in her case, what happened is she got the wounds because she was not feeling pain. So whichever injury you can get, it just goes unnoticed by the child. So they
the
became.
pain is it's like at the level of where the spinal cord injury is downwards. So they don't feel pain from at the back where the wound is.
Yes, there is
From that
diminished.
level,
Yes, there is
down,
reduced
there's no
sensation.
sensation.
But it depends on the type of the spinal bifida. Yes, and also the level. There are those who have some function, like those who are able to walk, and those versus those who are not able to walk. It depends on the level and the type of the spinal bifida.
Okay.
There's that very severe one where the spinal cord that is really exposed is damaged, that they don't have any sensation downwards. Then there are those who have some level of functionality. So that children are assessed, actually, when you're assessing a child with spinal bifida, you assess the level of functionality with the limbs especially. There are those who are able to walk and those who just need a wheelchair.
And all this was because of a folic acid deficiency sometime before the mother had conceived.
We had earlier discussed.
Yeah, kind of connected because it can be a bit big.
Yes,
and
folic acid is one of
if
the
it's going through, but all that happened because of something that took place
could have been presentable if it was the folic acid deficiency, because we said having folic acid prevents the chance of having a child with spina bifida by 70%, but it's not the only cause. There are also other causes.
Yeah, so this condition, it seems to be a very complex situation, and I think, Dr. Agatha, I feel people do not take it as serious, because if something happened in the past, like they do not take folic acid, antenatal and the likes, we could have prevented. In other words, I'm thinking this could have been prevented from the first place. So what are people not doing?
Okay.
Right, yes.
People, first, from last week, we talked about the importance of taking folic acid for all the women in the age-bearing group, because folic acid is one of the nutrients that is very essential in the development of the brain and spinal cord and other vital organs of the body. So we encourage the women to take folic acid for as long as you have a chance of conceiving. For those in the age-bearing group or those who are preparing to get pregnant, to take it at least a month before conception.
But I feel they should even be taking it throughout their life.
Yes, because it does no harm. It's not a drug. It's not a medicine. It's a supplement.
Okay.
Yes, of a nutrient in the body.
It's an additional small nutrient.
Yes. It's really readily available in the pharmacies. So you can take one tablet every day for any woman in the age-bearing group. Like I myself, I take it.
You take it?
Yes.
Okay.
So because it's proven that having folic acid, it reduces the chance of having a child with spina bifida by 70%. But that is not the only cause of the folic acid deficiency is not the only cause of spina bifida. It's a really complex condition that is still being studied about, but the other cause is associated to genetic factors, things that are running in the family, and then environmental factors, maybe some things that you're exposed to in the environment that are still being studied. Yes.
So you had it, folic acid, that small element, folic acid, which happens to occur naturally in greens and vegetables. Eating lots of that boosts your folic acid levels in the body, and therefore may prevent you from having a child who will be born with spina bifida, because it has been associated with low levels of folic acid in the mother. So I think the key message here is we must have a healthy diet, I think.
Yes.
Lots of greens, lots of vegetables. Attend antenatal if it's an expectant mother.
Yes. The other thing is to start antenatal care as early as possible. When you're expecting. Once you diagnose that you're pregnant, to start antenatal care immediately. Not to wait for when the stomach is big. Yes. And then also during the antenatal care, we encourage the mothers to do an ultrasound scan. That prepares them, if you know the child is going to have spina bifida, so we prepare them to deliver from a hospital where it can easily be treated, or near the hospital where it can easily be treated, as early as possible.
Okay, some more about spina bifida coming right after the break.
You are watching the Doc Talk Show.
Corner of the country, going out traveling to Mbali. They still delay to go to the specialists.
Yes, it may be because of the stigma, but then there is another big problem that makes them not to attend to seek medical care early, is they are not financially well. Someone is referred, maybe delivered from, say, Gulu, and then they have told you need to go to Mbale or Mulago. They don't have the transport, so they will wait. We've had children who have come when they are 4 months old, when they were referred at birth, but they didn't have the money for transport.
Or even the money for the surgery.
Yes, for the surgery.
It's not, I imagine it's not free of charge, is it?
No, it's at a fee, but it's a subsidized fee at your hospital. I don't know about the other hospitals.
Are these surgeries available in the public hospitals?
Mulago is a public hospital, and they do surgery there.
Okay.
Actually, this is a surgery for neurosurgeons. So where there are neurosurgeons, they're able to do it.
Okay.
But Kiwa Hospital is specialized for spina bifida hydrocephalus. Yes.
Because Because I imagine someone coming all the way from the far corner of the country, going all traveling to Mbale. I feel all these other hospitals should be empowered.
So that is
specialists.
So that's the problem of the government or something, that we have very few centers, the health system, yes, very few centers that are able to manage these conditions. I myself know about Kiwa, I know about Mulago, I know about Mbarara, and private hospitals in Kampala also do it.
Okay.
Yes.
How about you, Kathy? What problems have you seen? What things are people not doing right from your perspective?
Well, from my perspective, I think in the education system, there is a very big gap whereby they need, at least we've tried our level best to work with the Minister of Health, with the Minister of Education, to at least put some ramps, to at least have teachers who are trained in disability, but most especially these private schools, it is very hard. And they're not inclusive. There is a very big gap.
They don't have teachers who
are trained in disability. Yeah.
Besides that, there is a way the hospital, there are places also constructed, public places. We have a lot of challenges when the children, they say they cannot climb stairs because they are using crutches or they need a wheelchair. And then the school is flats and there are a lot of staircases. They are not able to access some of those things. So they don't even admit them in the first place in such schools.
But coming back to the point of the teachers who are trained in disability.
Yeah, like there is a title they give them. It has skipped my mind. But those teachers who are trained in disability, those special needs teachers, they're supposed to teach in disabled schools. Whereby now we have inclusive education. Even as we can go in normal schools. What they call normal schools, but they're not normal. Normal schools. Normal schools. Yeah. So now that is a gap that we, the advocates, we are trying to bridge. Yeah.
So we need more teachers
who are trained to manage children with special needs.
That is where the problem is.
Yes.
Maybe that's why the teachers were discriminating you, the refusing you to enter. They didn't have the
knowledge.
Yeah, they don't have that knowledge.
Yes.
They don't have that.
Neither do they have the skills.
Yes.
So you feel the education has to improve in that part. At least every school should have a teacher trained to
manage children with special needs. Yes.
Okay. I think that is more inclusive. That also helps to reduce the stigma, the problems which come with it.
And also accessibility on those buildings. Because where I finished my campus, wow, every corner had stairs, at least 2, 3, and I had to struggle. If I have a lecture like at 10, at least I have to start moving at 9:30, so that by 10, I'm in the class. And according to my course, usually our courses were in science block, and that science block had very many stairs. And like, Kat says, sorry, the lecture is up. And okay, it's okay, but during the examination, I could sit in the library.
But they're not mindful about the special needs.
Yes.
That's something
exactly,
that we have to, I think the planners and the policymakers have to be very serious about.
But the Building Control Act should come up.
Another thing about schools and these other places of work, because these people need the program that we told you about, the clean intermittent catheterization, the intermittent removal of urine. They need a clean environment which can offer them privacy for them to be able to do that procedure. So schools, there is that gap. They don't really have clean toilets or a place where they can sit with their equipment and remove the urine. So that's another gap that we've noticed. They don't even go to school because they don't have that
facility.
Yeah, that facility to
the hygiene
remove the
facilities.
urine. Yes.
And I think not only schools, many buildings.
Yes.
Many
Schools
buildings don't have it.
I've been invited for conferences, but because the building is not accessible, they're like, hey, you are late. But because I was on stairs for over an hour, because I take like 5, I rest. Like 5, because I use crutches, I can even slide and go back. So most of the buildings are not accessible.
Wow. So I think we have a long way to go as regards, can see the effects of spina bifida. It's not just about the drugs and the surgeries. It's all about how to improve the quality of life of the patients with spina bifida. So we have lots of work to do, clearly. It's not just the health system, but every other system. I understand we have I don't know if there's an MP of disabilities, they should be listening in and advocating for favorable policies that can support
the people
children with spina bifida or any other disability. Because it shouldn't be the case of they can't go to school X because they don't have teachers.
Yes, because they don't have
they went to hospital X and they didn't get treatment because something was
they
missing.
fear them or something.
Yeah, so we have quite a lot of work to do, and but the future is bright. I think we are making some progress. We are raising awareness about the condition, so it starts with raising awareness. People are aware of, yes, this problem is there, they see the gaps, and hopefully they can address them. So conclude this segment, we shall now come to focus on the prevention. And I'd like to look at prevention in 3 ways. Prevention, if someone is normal, how can they prevent someone from getting it? If someone is sick, how can they prevent complications? If someone has the complications, how can they improve and prevent, further complications? So we'll come back and discuss more about prevention of spina bifida right after the break.
You are watching the Doc Talk Show.
As we conclude this interview series on spina bifida, we want to really emphasize the message on prevention and management. What are the key messages, Dr. Agatha? I think this is for you now. Yeah. What key messages do you want to tell the public on how to prevent getting, first of all, if it's a mother, how can they prevent a child from getting spina bifida? In the event that their child is born with it, how can they prevent the child from getting,
the
complications? And I feel, there's some important messages in there. Yes.
Okay. If anything to take home from this series is to emphasize the intake of folic acid for women who are in the childbearing age, because it's proven that folic acid supplementation reduces the chance of having spina bifida by 70%. So I encourage all women in the childbearing age to take folic acid supplements a day, 1 tablet a day. Yes, it's not a medicine, it's a supplement that you need.
And I imagine lots of vegetables.
Yes, and then foods that have folic acid that include green vegetables that are not overcooked, eggs, beans, actually to eat healthy.
Healthy.
More vegetables.
Okay.
Then to start antenatal care as early as possible, and then to follow with the routines, the schedules, to keep up with the antenatal care schedules. And then if a child is born, if you notice that you're carrying a baby with spina bifida, we encourage you to deliver from the hospital, where you can easily have surgery in the first 48 hours to prevent the complications that include infections that can go up to the brain, that could lead to hydrocephalus that comes because of the infection. But also spina bifida is highly associated with hydrocephalus. Without the infection.
Okay.
You can just have a child, after closing the defect, they can get hydrocephalus. So we encourage frequent follow-ups at the hospitals to follow up with to keep up with the follow-up routine, so that if they notice that the child has developed hydrocephalus, it can also be treated early. Yes.
Awesome. So
and there's a lot actually.
Yeah.
Also the program of clean intermittent catheterization, where there is intermittent removal of urine to prevent frequent UTIs, to prevent kidney disease, because if you don't remove the urine, that urine that keeps redundant in the bladder.
How is it done, that intermittent
catheterization?
Yes.
Okay, it's a clean procedure, first of all, to start with, whereby the catheter, that's the tube that goes to the bladder through the urethra, yes, to remove urine from the bladder.
So
and then also there's a drug that helps to increase the tone of the bladder. It's called oxybutynin, that is injected into the bladder to help with the contraction and let out the urine. Yes.
So this intermittent catheterization is done by the parents?
So in the early years, it's done by the parents because we train the parents. So once the child starts growing and understanding, maybe from 6 years onwards, we train them to do it. So it becomes a CIC, self-clean intermittent catheterization.
CIC, yes.
CIC, clean intermittent catheterization.
So it's done by the patient.
The mother first, then the patient.
First, then when the child begins to understand, they start doing it by themselves.
Yes. Then also the bowel management, where there is a procedure also that they do to help to remove the stool so that they're not passing out stool every time.
Okay.
Yes.
Awesome. How about you, Kathy? Is there any key message that you want to tell maybe the parents, or you want to tell the leaders as regards spina bifida?
Thank you so much, Doctor. All in all, no matter all the challenges you face, now I'm talking to a youth, to the parent, to a child, to a family. No matter all the challenges, they can be maneuvered. Yeah, I managed that. I had a big head that I had to study, and I hold the Bachelor of Science in Counseling Psychology.
Wow.
And even I'm employed. Yeah, in a big organization. So kindly don't sit back. However much they tell you, no, this school we shall not take your child, try another one. Try another one. Yeah, don't give up. Yeah, don't give up. Just take the children to school. You youth who are there, or children who are there, just study. Because studying is the reason as to why I'm here.
I think it's also to parents. Don't keep the child at home.
Don't give up on the child.
Sure.
And to the leaders and the policymakers, we should have more teachers who can address, who can support children with special needs.
Yes,
They call special needs
teachers.
Yes.
Is it like a special training? I don't know. But we need
It's a
more of
course.
these teachers who can support these children so that they can also grow into well-educated people. And just like Kathy, who is a psychologist and is supporting other her fellow youth who could be having the same problem. So we need more of this effort.
We also need to talk to the community, to encourage the community not to stigmatize these people, because it's not their own making that they've had a child with spina bifida. And then even the people with spina bifida, they are not, there's that saying, disability is not inability. They are normal people who simply are living with a disability, but they are able to do everything else that you or anyone else is able to do. Yes, given the disability they live with, but they learn to live with the challenges.
Okay.
And we encourage you to reach out to everyone who has a mother who is broken, a mother who has a child with spina bifida, to come to the hospitals and then get this kind of treatment.
Maybe which hospitals now? Is the other question. Maybe they
okay.
don't know which hospitals to go to.
I will talk about the one I know. I know Chua Hospital is where I work. Please bring those children to us. We shall not turn them away. And it's not very, in the first series, Ruth talked about the expense. She was in a private hospital where she paid over 5 million, but the cost of surgery at Chua is 950,000 Uganda shillings only. So bring those children to the hospital, and then they'll get to associate with their fellows. There is Kathy here, she's a psychologist, so your child, just like Kathy, can study and become someone important in the country.
Well said. So you've heard it from our guests this evening. Spina bifida is real, and it's related to not taking a certain supplement. I don't want to call it a supplement really. A certain diet component, called folic acid. And folic acid naturally occurs in lots of our vegetables. You can simply go to the market and buy all those green leafy vegetables, and you have lots of folic acid in your body. If you're a mother, you will be given a tablet of folic acid whenever you go for antenatal. So please take antenatal.
And if you're planning to conceive, to take it at least a month before.
Okay, that's also important.
Couples who have just gotten married, you can start immediately taking folic
The
acid.
lady better start taking the folic acid.
You take any day. You can take it every day. I take folic acid because because I see the patients, I don't want to have a child with spina bifida.
Okay, well said. And yes, you emphasize the point of having good support systems to help people with disability. I think this thing really hits back at everyone. And it's not only children with spina bifida with disabilities. So we need to do more as a country, as leaders, to ensure that our systems, our health systems, our education systems, the social support systems, the counseling, etc., etc., all those systems are able to support people living with disabilities so that they can have a comfortable life and making sure their rights are not abused, so they cannot access certain services simply because they have this problem. So I want to thank you very much, Dr. Agatha, for coming on the show, for taking us through this elaborative discussion on spina bifida. And thank you very much, Kathy, for sharing your story and encouraging everyone to take their lives very seriously, to study hard, because I know with education, people can go for, you can do wonderful things just like you're doing. And this should be a message of encouragement to the parents who are out there. If you have a child who has spina bifida or any other kind of disability, please do not keep them at home, because you have no idea of what this child could be in the future. You could be like Kathy, who is now a psychologist and is helping support people with spina bifida or any other condition. So do not keep them at home. Take them to school, seek the right health care, and seek it early. Look for the health workers and look for them early enough so that we can improve these children's lives. So thank you very much for watching the Doc Talk Show. We'll see you next time. If you have any questions or comments regarding the topic of discussion today, spina bifida, or any other condition that we've talked about on the show, you know what to do. Just send it on our social media platforms, Facebook, Twitter. Also subscribe to our YouTube handle, and we'll be happy to respond to each one of you. Till next time, goodbye.
The Doc Talk Show.